Ebook Review. Campbell's Core Orthopedic Procedures, 2nd edition. Introduction A. Basic information of the book title, author, year of publication title, Campbell's Core Orthopedic Procedures author, Frederick M. Azar, MD, James H. Beaty, MD, and others, year of publication, 2024, the medical field that the book focuses. This book is concentrated in the field of orthopedic surgery, covering nearly all the field of sports medicine, trauma, and arthroplasty, and provides procedural vocabulary and writing. B. Reason for choosing the book for this review, its importance in medicine field. This is such an important book for the medicine field at large, where it serves as a reference book for all orthopedic processes, which are essential in treating musculoskeletal issues, from injuries to complex disorders. It acted as a guide to a vast number of orthopedic surgeons at all levels of their training or career. The relevance of the book to current medicine. This book is so relevant to the real face of the current medicine arena, where everyone is adapting to include the old age disease pattern and the injured and the sportsman. In other words, this book provides the advanced and basic abilities to handle the conditions and injuries of the people as per the current world disorder profile. 2. Summary of the book content. Main chapters discussed arthroplasty, covering all joint replacement procedures like hips, knees, shoulders, and the specific anatomy and procedural steps like the posterolateral approach of hip arthroplasty and the direct anterior approach of hip arthroplasty. It also emphasizes the accurate and anatomy variant in each case. Spine covers all spine surgery-related procedures like the anterior cervical discectomy, lumbar fusions, facet block injection, and covers both conventional and minimally invasive techniques, sinus surgery. Sports medicine includes repair and reconstruction procedures for common athletic injuries, such as ACL reconstruction and rotator cuff repairs, and applies a blend of open and arthroscopic techniques. Trauma presents treatment algorithms for fractures and other forms of orthopedic trauma, along with procedures like intramedullary nailing and fixation. Hand and wrist are composed of common hand and wrist afflictions like carpal tunnel syndrome and scaphoid fractures, which involves surgeries and non-invasive techniques. Foot and ankle cover foot and ankle problems and their surgical solutions, including osteotomies and arthrodesis. B highlights detailed procedural recommendations, supplemented by high-quality imaging and a description of each surgical action, generate an accurate, ideal case for orthopedic surgeons. A variety of basic to advanced techniques are described, expanding the handbook's relevance to a wider reader. Updated procedures and revisions to each existing technique to reflect present best practices and technological advancements in orthopedic surgery. 3. Analysis and evaluation A. Strengths of the book, accuracy and reliability of information. The information in Campbell's Core Orthopedic Procedures is accurate and reliable. It reflects the most recent research and clinical best practices and is grounded in evidence-based medicine. These ensure that the techniques presented are the most current and have been scientifically proven. Contributions to the medical field. In this way, the textbook makes an important contribution to the orthopedic field by being a reference with a broad and rich supply of knowledge, proficiently augmenting the skill and experience of practitioners. It significantly aids in the training of residents and continued professional guidance of surgeons, contributing to an overall decent flawless of patient care and surgery. Writing style and information display. The textbook is written in a clear and concise manner, but it is also intricate to understand given the complex and intricate area. The usage of detailed drawings and instructions makes learning the techniques simple, straightforward, and easy to comprehend. B. Weaknesses of the book, content or methodological insufficiencies. Although the text covers a wide variety of procedures, there is still the possibility of it missing procedures that are currently too novel or uncertain. Finally, the newer techniques introduced may not yet have achieved more extensive acceptance or generated more extensive long-term exit polls. This inadequately offers opportunities for more controversial arguments and conclusions on the part of practitioners more thoroughly, so far accustomed to the authentic element. On the other hand, the given book concentrated mostly on surgical procedures. Thus, it might have bypassed some aspects of non-surgical treatment for the cases provided, which is equally significant in the holistic provision of proper orthopedic care. As a result, variations in procedures for certain patient categories, such as pediatrics or geriatrics, either received diminished coverage. The following book is more succinct and procedure-oriented than Campbell's Core Orthopedic Procedures. Concisely compared to books such as Campbell's Operative Orthopedics, Campbell's Core Orth